Today, let's talk about anorexia nervosa. Anorexia nervosa, also known as anorexia, is defined as an eating disorder where a person extremely restricts themselves from eating. It is characterized by low body weight, fear of gaining weight, and body image disturbance. Anorexia nervosa is found in all classes of society. Although it is significantly common in women, there are cases of anorexia in men. It is estimated to be 4 to 9 times more common in females, considering that there are underreported cases in males. In terms of age group, it is found in a study that 40% of people diagnosed with anorexia are between 15 to 19 years old, highlighting the increasing incidence in younger years, and it is rarely diagnosed after 40 years of age. People can be vulnerable to anorexia because of their environment, upbringing, past trauma, their role models, and their goals in achieving optimal health. Aside from environmental factors, biological factors may also cause anorexia. Parents with anorexia nervosa have altered brain function and structure. There are deficits in neurotransmitters, dopamine, which influences our eating behavior, and serotonin, which influences our impulse control. Several other factors may come into the picture and drive a person to be anorexic too, such as severe maladaptive behaviors, depression, anxiety, low self-esteem, and conflict resolution difficulties. People living with anorexia might exhibit the following signs and symptoms. Intense fear of gaining weight, which makes them restrict themselves from eating. Obsessively counting calorie intake and consuming large amounts of fluids like water to suppress appetite. When it comes to anorexia nervosa, oftentimes patients not only avoid food and calories but also vomit them out. This is called Russell's sign. The way how they do this is by intentionally forcing themselves to vomit using their fingers or knuckles, causing friction on their skin by their teeth in hopes of eliminating any ounce of food that is inside them. The disorder also manifests widely in one's physical condition. Gastrointestinal issues such as constipation, anemia, slow heart rate, dizziness, fainting due to lack of nutritional intake, and persistent feeling of coldness. Dental problems like bleeding gums and dry mouth, dry skin and brittle nails, hair thinning and dry, muscle weakness, and yellow skin tone. Anorexia nervosa also often co-occurs with several other conditions, including anxiety disorders, phobias, panic disorders, post-traumatic stress disorder, and obsessive-compulsive disorder. Thus, immediate intervention is vital. And remember, support from people around them is important for long-term treatment to avoid possible relapses.
Anorexia nervosa results in significant physical consequences, diminished quality of life, and in severe cases, reduced independence and physical capabilities. Physical therapists also treat patients with AN, and here's how it goes. Upon admission, a specialized PT meets with the patient with this disorder, conducting a compassionate assessment. The therapist evaluates exercise behavior using the compulsive exercise test, important for understanding the role in the disorder. And next is educating patients on body mechanics and posture, addressing long-term issues like osteoporosis, and discussions of movement quality and quantity to support sustainable recovery. For interventions, they must include specific movement programs to improve musculoskeletal function and psychological well-being. Techniques such as neuromuscular education, walking, yoga, and therapeutic modalities like kinesiotaping and massage enhance physical resilience and overall quality of life. The therapies promote psychological well-being, improve body experience, and positive changes in mental awareness and stress management.